Did you know that across Dumfries and Galloway, 5 out of every 10 people in a cottage hospital could be supported in a more appropriate setting? People in their last 6 months of life spend 9 out of every 10 days at home or in a homely setting. In 2018, 62% of adults with long-term care needs were supported at home. This was the same proportion as for the rest of Scotland. Supporting people to live as independently as possible at home or in a homely setting is one of 9 national health and wellbeing outcomes that Dumfries and Galloway Health and Social Care Partnership is working towards. Another outcome we are working towards is supporting people to maintain or improve their quality of life.
Across Dumfries and Galloway during 2018-19, there were 2,745 people supported to live at home through self-directed support. This is sometimes referred to as SDS. Self-directed support puts people in control of their designing and managing their care to maintain or improve their quality of life. The number of people using SDS has remained steady over the past few years. During 2018-19, 345 people chose to organise their own support. This is referred to as option 1. 12 people chose an organisation to arrange their support. This is known as option 2. 650 people aged between 18 to 65 years old chose to have their support organised by Health and Social Care Services. This is referred to as option 3. The largest group of people supported through self-directed support are people aged 65 years and older. During 2018-19, 1,738 people in this group chose to have their support organised by Health and Social Care Services. Of these, 800 people required 10 hours or more care per week.
Supporting people who provide unpaid care and support is also one of the national health and wellbeing outcomes. Did you know that combined, each week people from across Dumfries and Galloway provide an estimated 400,000 hours of unpaid help and support? They are supporting family members, friends and neighbours who cannot manage to live independently without this help due to frailty, illness, disability or addiction. People in this role are called carers. Carers provide 10 times more hours of help and support than is provided through purchased care at home services. Across Dumfries and Galloway, it is estimated that there are 15,000 carers. This is equivalent to 1 in every 10 people who live in the area. Adult carer support plans are documents where carers can express feelings and identify needs and wants. This supports effective conversations between carers and health or care professionals, supporting people in their caring roles.
There are many things, such as being a carer, that shape our health and well-being. The air we breathe, the food we eat, the money we earn, the places we work, live and learn, the people we know, and many, many more. According to the Scottish Index of Multiple Deprivation, people from the most deprived communities in Dumfries and Galloway are 50% more likely to visit hospitals in an emergency. This difference is an example of health inequalities. For every 1,000 people living in a deprived community, there are 123 emergency visits per year. However, for every 1,000 people living in the least deprived communities, there are only 82 emergency visits per year. Teams from across health and social care are working with different groups of people to help reduce health inequalities and their impact. For example, health facilitators support people with learning disabilities to access services. During 2018-19, there were 412 referrals made to the Welfare Advice Clinic in Dumfries and Galloway Royal Infirmary and Mid Park Hospital. 87% of looked after children and young people completed a health and wellbeing assessment within 4 weeks. This is close to the national target of 90%.
During 2018-19, there were 46,600 visits to emergency departments across Dumfries and Galloway. A snapshot taken in March 2019 showed that 93% of people visiting hospital in an emergency were treated within 4 hours. This is compared to 91% across Scotland. Also during 2018-19, for every 1,000 people aged 75 or older across Dumfries and Galloway, 618 days per year were spent in hospital when people were ready to be discharged. This has gone up since the previous year when it was 554, but remains lower than the average for Scotland. Although both of these, emergency visits and delayed discharges, are measured in the hospital, they help us understand how well people are able to look after their own health and well-being in their community.
Ensuring that resources are used effectively and efficiently is a priority for Dumfries and Galloway Health and Social Care Partnership. Here are some more measures that tell us how we are doing. During 2018-19, there were 14,500 planned admissions to hospital. This includes planned overnight stays and day cases. 81% of people waited less than 12 weeks for their planned hospital treatment. Across Scotland, this was 68%. Also, people attended just over 300,000 outpatient appointments across Dumfries and Galloway. For those with a doctor, 96% of people waited less than 12 weeks for their first appointment. Across Scotland, this was 75%.
It is estimated that more than 10,000 people work for health and social care organisations across Dumfries and Galloway. 4,000 people are employed by the Health Service. 500 people are employed by the Council's social work services. 4,500 people are employed by independent sector organisations such as care homes and care at home services, and 1,000 people are employed by third sector organisations. Plus, there are many more people who volunteer. In March 2019, the sickness absence rate amongst adult social work employees was 7.7%. Amongst health employees, it was 5.1%. This is above the national standard of 4%. Supporting people to be well at work and recruiting and keeping the right people are crucial to the Health and Social Care Partnership.
It is important for the partnership to learn from people's experiences. There are many ways people can get in touch and tell us their stories. Email, phone, letter, social media, amongst others. The partnership's Facebook page regularly attracts over 6,000 hits. During 2018-19, the Health and Social Care Partnership received 418 complaints. This is against a backdrop of over 300,000 outpatient appointments, 36,000 admissions to hospital and 46,600 visits to the emergency department. Also, there were 228 instances where people took the time to contact the NHS feedback team to share their compliments. Our process for learning from complaints has been reviewed by the Ombudsman and the Scottish Government and has been identified as good practice.
Learning from people's stories is one of the many ways the partnership works to keep people safe. Adult social work services have a legal duty to protect vulnerable people. During 2018-19, across Dumfries and Galloway, there were 4,500 referrals for adult support and protection. Of these, 1,000 referrals were identified as meeting the criteria for duty to inquire, and 100 of these went to a full investigation. Other ways the Health and Social Care Partnership works to keep people safe include telecare. This uses a range of emergency alerts to provide support and assistance that enables people to continue to live independently. 74% of adults supported at home use telecare to help them stay safe. Infections can be acquired in different environments, including hospitals, other healthcare settings, and in the community, such as people's own homes and care homes. We monitor infections in both hospitals and in the community. Health and social care services delivered by statutory and non-statutory providers in Dumfries and Galloway are regularly monitored and inspected. During 2018-19, 81% of care services in Dumfries and Galloway were graded good or better in Care Inspectorate inspections. Across Scotland, this was 82%.
To support our continued improvement, the Partnership publishes regular performance reports. To view these reports and to find out more about Dumfries and Galloway Health and Social Care, visit our website at www.dghscp.co.uk.